To introduce our next speaker. So our next speaker is highly renowned, but also highly humble. So without any further ado, it is my honor to present a mentor to one of my mentors, Dr. Tyrone Grandison. Take it away, Doc.
And today I'm going to be talking about COVID-19 and the elderly. And I'd like to start by just acknowledging the time that we're in right now. Like, we're in a pandemic and it's just affecting all of us in multiple different ways. We're in a time where, well, literally the whole world is figuring out that systemic racism is bad and it's hurting and killing and harming people. We have fires and tornadoes and climate change saying it's real and we're here and here to stay. So I want to spend like just 15 minutes to just settle down, both after that audio, whatever that was, and embracing like what we're experiencing, to just center and to be here, right? So just 15 minutes of this time intentional silence. 15 seconds, sorry, not minutes. Okay, all right. I want to thank you for that. And I want to introduce you to Darlene. And Darlene grew up in Alaska. Her dad was an avid dog sledder. His passion kind of led Darlene to become a vegetarian and to be an animal rights activist. All values that she instilled in her 3 kids and her 5 grandkids. At 72 in Kirkland, Washington, where I'm based, Darlene died on March 6th from COVID-19. I want to introduce you to Patricia, Fryson, and Wanda, sisters. From a close-knit family, deeply religious, Patricia was the first person in the state that to die from COVID on the 16th of March, 2020, and her sister died 9 days after her on the 25th. So I like to bring up these stories, to share these stories, because it's important for us to always recognize that behind everything that we're doing, behind this data that we're going to be discussing, are people, are actual human beings, living, breathing people that have people that love them, that care about them. And it is our responsibility during this hackathon and while we're doing our work to make sure that these people are included. Now, to make sure that we're all on the same page, there are a few things that we all have to be aware of and that we all have to agree on. The first is that the world is getting older, and this shift is happening everywhere, and no country is going to be immune to the shift or to the consequences. And it's natural. It happens when you have life expectancy increasing and birth rates declining. The second is that the speed of aging across all nations is accelerating. So all countries are getting older faster. This means that by 2050, 20% of the world's population is going to be over 60. And of that 20%, 80% of them are going to be from low and middle income countries. And the third fact, which I can't believe I'm actually saying publicly, but I think I have to, and we have to be clear on and we have to agree on, is that COVID-19 is real. and it is infecting a lot of people across the world. Even worse, it's killing other people across the world. Now, in the United States, around February 29th, we had our first reported case, our first reported death that was in the news all the time. And the deceased guy was in his 60s, no travel history to China at all. He was in a senior living home in Washington State in Kirkland called the Evergreen Health Medical Center. A few days passed, and in March, we discovered that 2 other people in nursing homes that were close by also died. So then we had the case, the first death known to COVID moved to the 26th. Then, circled back to April, like 2 months afterwards, and someone in Santa Clara, California does an autopsy and finds out that someone there who died on February 6th died from COVID. And you can see this progression. You can see the fact that the nature of our understanding of COVID, simply because it's novel and we're just catching up and we're learning every single week, every single month. It makes it interesting. It makes it actually novel. So the interesting thing about like the elderly and COVID is that they're the first community, the first demographic group where we saw COVID and the effects of it, like being very stark. So given that, we can assume that, what that community is going through is what all of us are going to be going through at the time, right? So it could give us a good indication of like what is ahead for all of us, right? So what have we observed so far about the elderly and COVID? The first thing is that seniors are going through tough economic times. They're on fixed budgets. They're heavily dependent upon the state and federal government. Those who have jobs have seen their income slashed. They're making really hard decisions. We already know that seniors are dying at a really high rate versus other demographic groups. We know that shelter in place and social distancing are leading to higher cases, documented cases of mental health episodes in different care homes. We know that the availability of medical care for the elderly that need it is now reduced because medical practitioners need to be elsewhere. And also medical practitioners are being taken down, hurt by COVID. We know that the elderly can no longer participate as first responders because of their own vulnerability to COVID itself. And finally, we're observing that, well, we're not observing, like even before COVID, financial and physical abuse of elderly was like a hidden and a rampant issue, right? Where one example is like in the guardianship, adult elder guardianship field or realm, where you have probably 1.6 million adults being in elder guardianship, where guardians are in control of around $250 billion worth of estates. And financial fraud and abuse of those elder people is like well known, right? What we're seeing is that this is accelerating during the pandemic. Today, we can't actually look through and address all 6 of these things. We're just gonna look at 4, the top 4, the 4 that I think that we should be really focused on: mortality, long-term care, mental health, and elder abuse. First, let's talk about mortality. So when you look at freeopp.org, the first thing you see here is that countries that have a culture of transitioning their elderly into care homes see lots more death in care homes. Makes sense. And countries that are extended family oriented and oriented with or towards multi-generational living tend to have more deaths from COVID in this demographic at home. Right? If we were to, say, visualize this differently, and say tie the diameter of each one of these circles to the population of elderly people that actually died, both in care and non-care homes, you get the magnitude of the problem for each particular country. And you can actually see the magnitude of the problem for comparably for each country itself. So like right now we can see that UK, Spain, and Belgium has a larger problem on their hands for their particular country than say Ireland, France, New Zealand. When we focus in on the United States, the Center for Disease Control and Prevention tells us that the number of hospitalizations is dominated by people over 50. And if you look at the people over 65, that is approximately 77.1% of all hospital admissions as of June 6, 2020. When you drill down and you look at the deaths by age bracket, you see that the elderly represent 20.7%. This is still in June. Fast forward to September, doesn't look much better, but there's a glimmer of hope. It's now down 0.7%, and it's 80% of those people that are dying are above 65. The fact is that people that are over 65, when it comes to COVID, are 4 to 13 times more likely to be hospitalized than someone who's, say, 18 to 29, and 90 to 630 times more likely to die from COVID than someone who's 18 to 29. And this primarily stems from the fact that the elder communities are more vulnerable because they have preconditions. They have a propensity to have asthma and hypertension and obesity and diabetes. And the lesson we learn here is we have to stay healthy and we have to try and not to develop these conditions. Now, after the second issue, or the second area, long-term care. Now, the long-term industry, long-term care industry is actually like, it's fascinating. It's vast and it's complex. And I've been in it for like almost a year now. And the spectrum of care, the options are just like plentiful. You can have everything from continuing care, retirement community, CCRC, to in-home senior care, and like multiple different spheres in between that overlap, depending upon the level of care you need and supervision, and all of them have different cost elements associated with them. Now, for ease, the industry normally tends to put everything into 4 buckets, right? The first is independent living. So that's where you have freedom and you have access to other seniors and other activities. Assisted living, where you need personal care management, and you may require some help with some ADLs. An ADL is activities of daily living. So brushing your teeth, bathing, those types of things. There is third, skilled nursing or skilled nursing care. And there you definitely need a medical professional like looking at you every couple of days. And the fourth bucket is memory care. So that's the highest level where you require almost daily supervision because you have dementia or Alzheimer's. Now, NIC, which stands for the National Investment Center for Senior Housing and Care, is a nonprofit that monitors the market aspects of the long-term care industry. And NIC's map data service, a very useful tool, helps you understand the business aspects of the industry. And NIC just released their Q2 2020 Market Fundamentals Report. And the 3 big takeaways are that senior housing occupancy is around 84.9%, and that is down 2.8% from the prior quarter. Assisted living is at 82.1%. That's down 3.2% from the last quarter. And independent living is at 87.4%. That's down from 2.4% from the last quarter as well. So we're seeing a decline in all different options of senior living. If we were to just drill even further, and here IL, independent living, AL, assisted living, NL, nursing care, and look at the trends year over year, we clearly see that there are more empty beds in long-term care facilities. And it's a combination of in-facility fatalities and fear for people that may have wanted to be in a long-term care home, but because they're hotbeds, they just don't want to do it at this point. If you drill down even further and look at the different metro areas that Nick covers, you see that the trend, the decrease in occupancy is still there, it's clearly there, except for a few outliers in Seattle and Sacramento, which to this day I still can't figure out like why it is increasing year over year for those areas. The good news is that Nick just started a study on the impact of COVID on older Americans in senior care homes, right? So we expect to have a result from that in the next 2 to 3 months. But from their preliminary study that ended in May, we can clearly see that there's a correlation between the type of care that you're getting and the propensity, for you to actually get tested and the propensity for you to have a confirmed positive test, right? So if you're, a memory care or nursing care resident, then there's a correlation to you having a high chance of being tested and a high chance of having a confirmed positive test, right? However, this is just all preliminary. We're hoping to actually know more once this next study is finished in like a few months. So mental health. Mental health was one of those areas that was the elephant in the room pre-pandemic, right? Across all demographics, across all nations. In the US alone, it was 1 in 5 Americans in 2019 that reported having a mental illness. So that's around 47, 49 million people. And of those, you have like 20% of that, so around 11-ish million, saying that they had a mental health episode that required them to just like stop doing things that were important to them. The problem is just like in this community, in the LA community, the uncertainty and the fear around this pandemic has led to increased effects on their mental state, right? There is the fear of death that is heightened. They tend to ponder the possibility of losing their loved ones and not being able to say goodbye. They have guilt and shame that's associated with being possible carriers. All this like leads to a situation where you have self-neglect, you have them not following their prescribed courses of treatment. It leads to higher levels of being susceptible to misinformation. I mean, there's a really good NIH study that came out in June 2020 that outlines all the effects that they were seeing from March until June. However, when you actually look at or look forward data, as was the case before the pandemic, it's limited, right? Because there's a stigma attached to mental health. Now, the scarcity of data in this period is even more pronounced, and it's even more pronounced in the elder community. There are, however, a few glimmers of hope. The Kaiser Family Foundation has been exploring this space by sending out surveys over the last few months. And over May, June, and July, they uncovered that there's a steady increase in people saying that they have symptoms of mental health issues. When you dig in and you look at only people 65 and over, you find more and more people in this community saying that they're worried about the impact, the negative impact of COVID on their mental health. Now, a final area is elder abuse. Now, the WHO, the World Health Organization, like pre-pandemic, reported that elder abuse is a huge, significant problem that's in the shadows, right? And that 1 in 6 people, older people in the world, has been abused, like last year. Now, given what I said at the very beginning about the world quickly aging, and we're all going to be in this demographic pretty soon, like it behooves us to actually think about how we're going to solve this and pay attention to the ramifications of elder abuse. Elder abuse can actually take many different forms. I mentioned earlier the issues around elder guardianship in the US. It could take the form of neglect and abandonment, sexual abuse, emotional abuse, physical abuse. And it can happen at any time, and it can happen repeatedly. When it comes to abuse, it's normally performed by somebody that has power or has power over the elderly, right? So it's normally a judge that decides that somebody is mentally incapacitated, right, and can't actually make decisions for themselves, and puts all their estates and their decisions into receivership for a guardian to actually take care of. It could be in the form of a healthcare worker that may have had a bad context meaning day, upbringing, weak, whatever else, and has a moment where you take it out on somebody who's in a home. It happens everywhere, and sadly, no one is actually monitoring. Just like with mental health, you kind of suspect the rates are much higher than they currently are being reported at, but no one has a true estimate of like the real size of this particular problem. From the data that we currently do have, we know that the ways to actually address elder abuse are very limited. And people that are being abused are fearful of reporting it, either because they fear retaliation or they're worried about their abuser getting into trouble because their abuser could be a family member. Cognitively, they're not there, or they feel ashamed or embarrassed, that they're going through this. So we also know, and this is factual, like we know that it has an impact, a really devastating impact on the people going through it. And we know that it places a significant burden on all our systems, particularly the American healthcare system, to the tune of $5.3 billion. We also know that of the people over 65 with mental health issues, 66.67% of them have experienced abuse, right? But we also know that it's just not limited to them, and it can happen to any older person. So unfortunately, we have suspicions about the rate of elder abuse accelerating during the pandemic. As mentioned before, the data is scarce to actually see what the true size of this problem is. The incentives for the court system, for the legal system, the justice system, the medical profession, to even try and change or address this is just not there. And as we're all getting older, we're all going to be in a position where we can be taken advantage of. So I think it's our responsibility to spotlight the problem and to seek out solutions. I'd recommend that we all look into the WHO's initiative on the Decade of Healthy Aging and figure out how we could actually all play a part to improve this, not just for the current loved ones that we have that are older, but for the future. With that, I want to thank you and open the floor for questions.
Shilpi, do you have time for questions?
Yeah, Ty, I think we are out of question time.
Okay, no worries.
Any specific questions audience would like to ask? I don't even see any specific questions.
I think Bruce had one question. Bruce, do you want to turn on your mic and ask quickly?
Yeah, let's do it.
Sure. Hey, Ty, Bruce Hoffman. I was, we recently had done another hackathon where there was a lot of stuff related to mental health. And I just wondered, has any of the measures you've gone through shown that the risk and or, has increased significantly, and maybe also just within the elderly during this, during COVID? Since I saw all the other numbers you showed, it looks like there's fear.
Yep.
That would show just from the reduction in attendance. So I'll be quiet there, but that's what I was wondering.
Yeah, so I mean, there are a few academic papers out now in National Library of Medicine that are hinting to like there is an increase in different geographies, but we don't have like a full view across the US or a full view across the world. We know that it is a significant problem in, say, Massachusetts and some parts of California, but that's as much as we know right now.
Got it. Well, it'd be great to see, any follow-up on studies on it. I think there's some opportunities to help.
Yeah, I think if you look at the CMS's nursing home data and probably the specific senior living resource in your particular state, that's going to be your best bet right now. I'm not advising anyone to look at CDC for anything at this point. All right. With that, I want to thank you so much, and I apologize for the audio issues at the start.
No worries, Ty. Thank you so much. This has been a pleasure. Awesome presentation, and loved your insights on COVID for elderly. Thank you so much for sharing.
Thank you.